And in studio with me this morning is nominated Senator Agnes Zani. Thank you so much for creating time for us.
Thank you.
Staying safe, keeping distance, as you can see in studio. Yes. But how have you been generally?
I've been fine, thank you. I've been fine, thank you. Going about our work as usual, and you know, now changing times, changing fortunes, changing approaches to life. You know, about 2 months ago, 3 months ago, we didn't know we would be in this situation. But I always say that life goes the way it does, and we make the best out of we can, out of it as much as we can. And I think this is what we're trying to do. And I think the advisories we are making are very, very important. We can make comparative analysis across the region, Rwanda, Uganda, Tanzania, and just see, even as we look at the case of Kenya, really seeing that the efforts that we have made in Kenya are bearing fruits. Look at what we can improve further on, and just stick to the mantra of what we are being told to do by the Ministry of Health.
Sticking to what you're being told, and of course you'll also be digging into what you are doing as a leader in your own capacity to help you know, bring in policies and changes into this whole journey. All right, allow us now to begin our very important conversation on COVID-19 in the Kenyan context, looking at it through our own lenses, how it has changed our lives and what lessons we are drawing from this whole journey. What do we really need to do? How do we change our healthcare system so that we can accommodate not just coronavirus, but in the future when we face such a pandemic or whatever it is that will come? Because even this didn't knock, it didn't prepare us. So when we get to that point that we are faced with such a calamity, such a crisis, how can we handle it better? It can only depend on how we handle this one. So that is the conversation that we want to talk about, including how to cushion Kenyans in these trying times. And joining me to have that very important conversation is Senator Agnes Zani. Thank you so much once again for creating time for us. You have been baptized the senator with the highest number of bills. I see that a lot, and I said one day when we're having such a sit down, I would ask you how many bills are these, so that in case one day I become, you know, a mheshimiwa, I will try and beat that record.
Thank you.
How many bills are we talking about?
This is the 8th bill.
The 8th bill.
Yeah, you know, I was in the 11th Parliament as well. That lasted for about 4 years. And then together with this Parliament, or the 12th Parliament, I have a total of 8 bills now, with a couple of more coming in, because I think with bills, it's just that sometimes you interact with the communities and societies and you find gaps here and there. The next bill that is coming is the Societies Act Amendment Bill.
It's on the way.
It's on the way, because recently I was doing some work with the society.
Stop, do you?
Because you see, every time, I think you sort of coach yourself to have a lens to looking at where the gap is. The Privileges Bill that is also now at first reading in Senate is also coming, and that basically was born from realizing that we come up with so many motions and so many statements, but then the implementation part, there seems to be a delinking. So this is basically saying, could the public officers give this feedback? Could we find a way to implement? Because we can have so much that is very good and then it goes away. And right now it's the Community Health Services Bill that really started coming up in my mind about a year ago. Actually, it was by coincidence that it's coming up now for first reading when we have the COVID, and realizing therefore even its relevance at this time of COVID-19.
It's not anything planned, like I was about to ask.
No.
Did you see this coming? Because it's a very relevant bill that touches on very fundamental issues that we are dealing with right now with regards to our healthcare system. And looking at the environment and the pandemic that you're dealing with, one would have thought, did Senator Agnes Zani know that we could get to this point as a country, or is it just something that was already in the pipeline?
Yeah, I think it's about systems and structures. And when you think about systems and structures, these systems and structures are always relevant at any time. It's just that they're better even when you have a pandemic. But really what I think about is that it's good to have act on them even in advance so that you have them in place. If you look at countries, for example, like Germany, like Switzerland, right now as we speak, they've been able maybe to counteract COVID and maybe do certain things in a certain way. And of course, we are cognizant of the variation, even in terms of countries and responses. But then maybe if you have certain systems in place, for example, if you have a primary healthcare system in place, it makes it very, very easy for you to deal with anything, you know, with, be it a cholera outbreak, be it a malaria outbreak, whatever it is. So I think I just started thinking about what might be missing. And I think the issue of community health workers, who we know in certain counties have been entrenched within their counties.
All right.
But
yes.
yes.
We are about to, you know,
to delve into it.
Of this bill in a bit, but let's begin talking about the stages. Today being the 5th of May, the bill is open to public participation, if I'm not wrong.
Yes.
Probably just take us through the stages this bill has gone through so that we know at what level are we and what is the next step and what is to be expected now that it is open for public participation.
Thank you very much. This bill finally then got published, I think about 2 weeks ago. Before that, we decided to have a different approach. We decided instead of just doing a bill and then calling the stakeholders to input, I had the stakeholders come in earlier, especially the CEC members from the counties in the health department, coming in, or in the health ministries within the counties, coming in, and we had a discussion at Hilton Hotel about mid last year. And we just sat together, and by then we're still in the process of writing the bill, and we said, this is the bill, what do you think is important, what do you think we're missing, what sort of input should we have?
So the input,
it's been a journey.
And involving so many heads put together.
Exactly. Then finally, you know, we got it published, so it has been published, it's been read the first time at Senate, and today we're having public participation. Today's public participation will be different. Public participation is a very interesting time for a bill, because you have the stakeholders all coming in and speaking, but unfortunately because of COVID-19 we'll not be able to have that set up. So the public participation is going to be done through memoranda that is going to be sent to the clerk of the Senate, and this is through the newspaper advert that was put for the bill. So today we're having public participation. After public participation, we go back to the committee. This bill is now housed under the Committee of Health, where Dr. Mbito is the chair of that committee in the Senate, and we will look at the public participation input into the bill in preparation for the third reading, but this bill will immediately go into second reading at the Senate, which gives it a chance to be debated within the Senate. And then immediately after that, we go into third reading, into the Committee of the Whole, just before the third reading, where we take the amendments that have come through public participation and through stakeholder engagement, put that in the bill through the third reading, and then we're done with it. And then we go to the National Assembly. And the National Assembly, we wait for them to go through the same process again. If they make amendments that that are different from our amendments, usually we end up with a mediation committee, where then the two members will be selected from Senate and the National Assembly, sit together and come up with a version of the bill that is acceptable to both the houses. At that point, then it becomes, you know, we end the process of it being a bill. If then it proceeds to be accented to, then the president accents to it, and then becomes an act and therefore a law.
It is a law.
So that's the process, more or less. Yes.
So if it becomes law, it contains quite a number of issues that seek to sort of like bring an about turn in the healthcare system. And the key focus of this bill, from my understanding when I was looking at it, it involves, you know, bringing the community healthcare workers to sort of elevating their role in the healthcare system. I want you to talk to us about this bill, the Community Health Services Bill 2020. What would you say is the key highlights of this particular bill for those who really want to understand how this is going to change our narrative in the healthcare system?
It actually tries to finalize and put into situation recognition and entrenchment and modalities of community health workers within the county. In many counties, community health workers exist in one form or another. And we're looking at community health workers that come just below the extension health workers within the schema of the protocol in the health in terms of the positions that they have. these are the ones that are completely attached to the communities. These are the ones who go to a specific community, they talk to members of the community. They're the first responders to any calamity. If there's an outbreak of cholera, for example, they're the ones that can go to members of the community and explain to them what is happening. They're the ones that can easily pick what is happening from the community. They're the ones who can realize, oh, there are people, for example, who are suffering from cholera or who are suffering from tuberculosis, and give them the first instance into the scheme, into introduction into the main health system.
Right. You were talking about this Community Health Services Bill 2020. You had begun unpacking the highlights of this particular bill, and of key focus here was the community health workers, and you were telling us how significant they are. I think we have not really paid attention to this aspect in the past.
I think so, and I think this comes up very clearly in the bill at clause 12. All these responsibilities for the community health workers are put in there. The responsibility for registering them, so we're advocating for a register at the county level so that they are known. The allocation of duty that they have to be given, this is put in the responsibility of the CEC member within the county, so that, for example, if it's one community worker to 500 people within the community, they are able to be given that particular task, that people know who these community workers are within a particular community. So these are introduced at a baraza. Indeed, even the baraza has a say, because community health workers work within a community where they're well known, trusted, and they're the first responders.
So they're generated from within.
They
understand the issues on the ground.
They understand the issues on the ground. They have the expertise. They have the necessary training, again, which is critical, which we are also advocating for in the bill. Spousing on this training. We have also the element of them being able to go out. For example, they will go out with paperwork and sheets and be able to say, we've covered this and we've covered this and we've covered the other. It's not a new concept, Safin. This has happened already before. But I think the structure and functionality of it is what we want to put into place. There are certain counties already that have entrenched their community health workers, and they have a system of how they operate very, very clearly, while others don't. Some have actually even created laws within the counties. The county of Siaya, the county of Homa Bay, the county of Turkana have already come up with a system where they have really actually legislation within the county that enforces how the community health workers need to work. And I thought if we have sort of like a mother bill at the Senate, really putting all this together, then it can actually trickle down, so that the CEC member for a particular county has a systematic schema of how to run the community health workers within the communities. In many communities, they're also seen like CHVs, volunteers, rather than workers. And we're moving towards empowering them to look at them as workers. WHO is very clear that the terminology is community health workers. In some places, they worked as volunteers on and off, 2 hours in a day. Some are paid, some are not paid. So we just want to create
the level of commitment was also compromised.
Yes. So it's already they're already operational. This bill wants to just enhance their operationality, as we have just said. When we enhance operationality, like we're seeing what is happening in Muranga, then we make things better for everybody. Yes.
Things work. But then, if you look at the structure of the healthcare system, this is really basing its foundation on grassroots, bottom-top approach. If you look at that particular structure and what we have right now, how do you compare the two, and how is the current system working for us? Is it on a positive side or on a negative side? I
think we have the structure all in place for a national to county dialogue, and also from a county to national dialogue. So, for example, with certain provisions in this bill, we're saying, for example, we're allocating responsibilities which are already there for some of the specific ministries at the county, at the national level, for example, for policy implementation, for policy construction, coming up with the necessary policies, coming up with the necessary direction that needs to be taken in consultation with the counties. And then counties also have their part to do. But I think what happens, is in the schema of national to county and county to national interaction, especially at the primary health level, there's this gap now that we are identifying that needs a little bit more to be done into it. We have the community health assistants, for example, at higher levels, and the community extension workers at a slightly higher level, but now we want to go back to the basic unit, and that is the community where it starts, so that by the time this person is actually going to the earliest health unit, be it, for example, a dispensary, be it, for example, a clinic, they've already interacted with the community health worker who is able to give advice. The community health worker can even give advice for prevention, like especially now at COVID time, the community health worker will be in the communities advising and saying, for example, wash hands. We are relying a lot on technology in this war on COVID. Most of us are listening to the TV, we're doing WhatsApp. How about that community member deep in there who might not get a chance, for example, to get a WhatsApp message?
There are places that do not even have network for communication, the normal calling.
Exactly.
So you'd imagine internet now.
Exactly. So this is where the community health workers, because if this is very structured, the CEC member would have already communicated with the community health workers through their specific hierarchies, and then by the time they're going out into the field, they're going out with specific instructions, they're going out with specific advisory, they're going out with specific intervention that they can do at their level. They're going out to be able to link the community workers with the nearest health unit available to them. So it is a bottom-up approach, emphasis, not that it doesn't exist, it already exists, but it's just emphasizing that in good times and bad times, let's entrench this. Because if we do, even tomorrow we'll be able maybe to avert a situation that is coming up in terms of health. And we know, for example, like especially with COVID, we're saying COVID is about health and health standards, washing hands, taking care of your environment. This is something that will live with us to covert or to ensure that we combat any other diseases that come. In fact, we're saying probably past COVID-19, maybe they won't even be something like past as such, in the sense that hygiene is very important. All these will help us to avert many other diseases that might come our way.
There are already reports, Mheshimiwa, that cases of diarrhea, stomach aches are going down. It's being reported that those who used to suffer from this, the cases are going down. Probably it could be all thumbs up to the increased standards of hygiene at this particular time.
Yes, I had that, and we need to be able to ensure that we are very careful about confounding effects. Is it that they have gone down or they are less reported? Or less, what could be happening. So I think that might need a little bit of research just to ensure that there's no spurious correlation, but it is possible. What you're saying is another explanation, that probably because of better hygiene, everything has come down. And that is also a position that can happen. So I think it is a yes situation. It's a gain for everybody else. If we have community health workers, in fact, what we should be advocating for in the next 2-3 years is to actually say that for one community worker, let us have one community worker working, let's say, with 100 community members. At the moment, it's about one health worker to about 500. But as time goes on and we realize the importance and the role that they are playing, and even what they need in terms of input is not that very expensive in terms of, they're not coming, they don't do the curing themselves, they can do the referring. But whatever they need to do is something that they're already, some of them, doing. So it's really just a question of motivation, a question of structuring, a question of functionality to enhance these very great outcomes.
All right. I also think the biggest challenge probably that has really affected the work of community health workers has been the lack of the know-how, the information, their training, and just making them be people who can speak with a voice of authority on issues that touch on healthcare. Probably lack of that has made them not really being seen as people of significance when it comes to health matters. Does the bill address anything to do with equipping them with the necessary information, probably training or capacity building?
Yes, it does. It really gets onto the issue of capacity building specifically for them. This is done within a stigma of what we're calling, or within a situation of what we're calling a health committee to be put up, a county health committee to be put up in all the counties, within which, together with the director and the CEC, they'll be able to look at the specific content that is necessary within health within that particular county. organize for this sort of training that comes, that they can actually organize for and prepare the health workers to go out there when they're very well armed. Most of the community health workers currently do have good knowledge about what is happening because it tends to be more specific towards a particular community. For example, community health workers in Turkana will be addressing different interests, for example, from community health workers in Kisumu. You know, right now, community health workers in Kisumu might be engaging more across the flood and what is happening. We have cross-cutting issues across the board like COVID-19 that would be addressed in all the other counties. So remember, this community health workers coordination needs to come along the line of a director general that this bill advocates for. This director general will be going out there to identify what are the needs for this particular county at a particular time and coordinating within the committee and within the CEC the sort of information that should be going out, the sort of information and knowledge that should be going out, the sort of training where it is necessary. They can be given training, specific training for a particular outbreak for a disease so that they can go out with that knowledge. All that is catered for. And very important, even their registration. So we're advocating for registration of all the the community health workers, together with their registration, also their ability to be able to go out there when they're recognized. Who is this person who has come to this particular community? Because we don't want somebody who is going to just, you know, appear. We want somebody who has been registered, they're going to this particular community, they're expected there at a particular time, and all this is known. So it's mainly about coordination and functionality, and yes, training, very critical.
Is needed.
Is needed, yes.
I'm sorry to go this direction, but I'm looking at this in terms of cost as well.
Yes, very important.
At what expense, yeah? Because we are changing the narrative from community health volunteers to community health workers, training them, registering them, and making, you know, sort of an organized way of conducting business. I know this is not going to be a cheap affair. Let's be realistic.
Important issue.
And the reason I'm asking this is because, yes, we want to go this direction. Yes, we want a solution that will help that, you know, granny in that small village that may not have, you know, access to internet and all that and the best healthcare system. But then, aren't we really making things work double, because devolution was supposed to provide this solution? So what went wrong, and why are we seeming as if now we are creating double positions, double roles? Don't we have people on the ground who are supposed to be doing what you're describing this morning, Mheshimiwa?
I think it's important. I think that's a very important question. I think we want to ask ourselves, what is the overall cost for any county and for humanity? The cost of enhancing health or the cost of not having mankind altogether? Because in between, we need to have a system where money is put out there so that people's health can be enhanced. Through people's health being enhanced, they can actually work, they can bring in the taxes, and they can bring money. You cannot have a healthy nation. It's a working nation.
It's a wealthy nation.
It's a wealthy nation.
Yes.
So that's the first sort of kind of parameter that I'd want to look at. Number two, for the counties that have been able to entrench the community health workers within their systems, they've been able to make it. I want to address a very important issue, because when you touch about money, and especially in terms of bills, this will always come. And the first thing is, when you talk about money, many Kenyans listening and many Kenyans within the legislative system say, then if it requires money, is this a money bill? A money bill is a bill that will enhance or will need, for example, the Budget Committee of the National Assembly to put in more money. There's already money that is going for primary health to the counties.
So we already have the budget for it?
We already have a budget for it.
Sounds
We already
fair.
have a budget for it. And in terms of a money bill, the appropriation that's done at the National Assembly determines that this bill needs money appropriation, then it becomes a money bill. This bill is entrenched, is hinged on the equitable share that is already gone to the counties, that has already been appropriated at the National Assembly level, and has gone into the counties. Moreover, just a little bit for Safin, the issue of conditional grants and also grants from donors also exists within the counties. So for some of the counties that have already been able to do it, yes, they've been able to do it. They've given money, not a lot of money, but they've given money sufficient to help these workers do a good job.
All right.
Yes.
Something that has brought in a bit of positive way of looking at it is that the fact that you're saying there is already budget for it, and you will help us understand more about that in a bit. But then now let's cross over to the coastal region in Mombasa today. The Kilifi Deputy Governor Gideon Saburi was presented in court. Remember, he has been having a case that touched on him being accused of violating the guidelines that were issued by the Ministry of Health to combat COVID-19. He was released on a cash bail of 200,000, and investigations have been ongoing for about 14 days just to get more details about this particular case. Today, what we're expecting is a ruling concerning this case because the investigations have been ongoing. But then again, we will be crossing over to the coastal region. I understand later my colleague Michael Mwadiga is following up on that case this particular morning. But it is among, you know, one of the things that have turned out to be very unfortunate in this war against COVID-19. He's not the only person. Senator, we have seen other people as well who are defying the guidelines that have been issued by the government. There are people still attending weddings in secret. Others are still attending religious services in secret. Others engaging in drinking sprees in secret.
Yes.
What does it tell about us as a people first, before we even get to how it's affecting the war on COVID-19?
Yeah, I think there are different sides of a story, and it's important to listen to all the sides. And even in the narration that has happened for the Deputy Governor of Kilifi, and even the explanation that, for example, that has been given in court, that yes, I was tested and I tested negative, and therefore I thought, you know, I didn't have a problem. The instructions from the ministry that you must be quarantined when you come in for 14 days, regardless of what the testing is. I think, again, our communication system to set this clearly onto board, I think everything was happening all, you know, at the same time, more or less. And of course, we have this situation we have right now, which the Deputy Governor is trying to go through by clearly saying, okay, I have done 1, 2, 3, but I want to obey the laws as much as possible. Then we have other cases where I think this is to do with culture and social and life and socialization. I think people just have a way of doing things. And I think the message to help them to really move away from their usual way of doing things can become tricky. I think sometimes also maybe with COVID-19, I think people are just like, you know, I think when it is, you know, something that happens and you're spilling blood, everybody will be like, oh my goodness me, you know. I think this is amorphous. And yet it is real.
People wait to see
this is it, but
evidence.
we've seen in
until I hear somebody I know, that's when I'll believe you.
But we've seen Italy, we've seen New York, it's going through. But even in that same New York we're talking about, we've seen what has happened in America. That people have just so I think that's human behavior. I think once everything really heightens, people then get to realize. But I think what the government is doing, this is it, and that's why I'm saying that what the government is doing is very, very important. Just keep talking about the message, talking about informing people, talking about informing them what they're meant to do, social distancing, keeping away from social functions and celebrations, taking charge in cases where, for example, we've seen people having like a celebration, they've been taken in and they've been taken to quarantine, for example. So I think this is an unusual situation. We're not yet used to this sort of a setup where something as drastic as this has happened and we'll be given instructions. But I think slowly we're getting there. I mean, you can see even in terms of the curfew, for example, over time, people have learned to live within this particular Actually, the keyword, Safin, you've used correctly, adjust. It's about adjusting. Drastic adjustment just needs to be done. We're all doing things differently. The other day, I sit in the Committee of Education and also in tourism and industrialization. We had a meeting via Zoom, you know, and there you are, you know, you've got to learn, press your button. So it's a learning and an adjustment period.
It's the new normal.
Yes.
That's what they all say now.
Yes.
Yeah, we'll get to the point of talking about Corona and how we are adjusting to it later, but I want to allow you exhaust more about this particular bill. Let's get back to that. You're talking about devolution, and I want you to, you know, just talk about why it sort of seemed like it did not answer the questions that we all had. This baby we were trying to raise, still we are waiting to see results from this. I'm talking about the healthcare system. There's a lot. We even see the back and forth between the national government and the county. When
including
has health been devolved? Why are you doing this? When healthcare workers are on strike, you'd hear that back and forth. It seems like there's still a lot of gray areas that need to be addressed, don't you?
Yeah. I think in the Constitution 2010 was overwhelmingly voted for because of devolution. people believed in the devolution dream, and it has worked to a certain extent. In various counties, for example, we have reports from counties like Mandera, for example, they did not even have any health care facility at the county level. Now some progress. When we talk about maternal health care, for example, that women can go to the nearest place and be able to give birth. But on the other hand, we have real issue when it comes to who should do what. And I think partly this has to do with the Schedule 4 of the Constitution in terms of the delegation of the functions into the various areas into the counties. This has touches a little bit on education. I think the components of education also sort of touch on the components of health. There are certain components that have not been devolved. For example, national policy, curricula, and training. These remain at the national level, and some have been devolved to the counties. What should ordinarily happen is that when a function is devolved, the cash should follow the function into the ground. And I think in between, something hasn't really worked. I think the coordination in terms of the health aspect hasn't really worked very well. Either the calculation for even the funding for the payment for the workers, the nurses within the counties was not factored well into the function. Maybe a lot of money remained at the national level that should have been factored for salaries.
More functions went, but more money.
Exactly, exactly.
Remained on the other side.
Exactly. So in some places, the money it did not directly follow the functions, and the devolution of those functions has not really followed through properly. So we find a situation now where we have all this acrimony when it comes to the issue of unions, when it comes to the issue of trade and bargaining, for example, CBAs, collective bargaining agreements that have to be put into place. You see this, the same thing again in education, you know, demands are being made, but the county is also saying, look here, we only have equitable share to distribute. This is the equitable share that we have to distribute. We have conditional grants and other donors that can come in, but this is what we have. Can, for example, national government, for example, take cognizance of this when it comes to the bargaining agreement, the policies, the staffing that is still happening at the national and not in the counties? And you saw county governments really fighting. I think even now for the community health workers recently during COVID times, and they actually said we need to get more community health workers onto the ground. The issue of funding came, and the issue of also employment came, and national government started making information for the application. And I remember the COG coming up very clearly and saying, no, this is a function for the counties. I think devolution is a process. If you look at countries that were devolved long before us, Nigeria, US, it's amazing. When you benchmark, they have lots of issues as well. It's not something that happens suddenly. But I think those functionalities, being able to separate them, and the issue of funding is what is very critical. This money is going into the counties. What exactly is it funding? By entrenching social community health workers, when they have been entrenched, how much do we require? Where are we going to get it from? How are we going to get it from the donors? Which portion can we get to the donors? Primary health being a component that is being devolved into the county governments. How much money is there? So I think some sort of negotiation needs to happen. That the counties, I think, I would suggest, need to come with a feasibility. They need to come up with projections for costs. They need to be able to come up and share openly. They say, these are our costs. For our equitable share, this is what we've been able to do. And this is the extra money that we need to be able to really fill this hole. What initiatives can we do? What partnerships can we have, for example, with national government, so that some of this money can trickle back into the counties? And I think this is a healthy discussion, because finally it ends up being exactly that.
Bringing solutions. So we shouldn't be too hard on ourselves.
We shouldn't be too easy. We shouldn't be easy, because that's the implication.
No, we are not doing too good, but
we shouldn't be easy either. We should really continue to just look at best practice and say it can work. Take it to the higher level, take it to the next level, take it, always make it a challenge and fight hard to face that challenge. If we do this at ordinary times, we'll be sitting back and having an easier time during pandemic. So it's always good for society just to be prepared at any one time. It never stops. For as long as you live, you're always improving yourself.
All right. So even as we face this pandemic, all this that is being done, it shouldn't have been done now. We should have done this before the pandemic, but it's a step in the right direction either way. Some of it was done. It can be bettered. Yeah. I want to talk about something that has been a point of concern for many Kenyans. What you're describing seems like the ideal. Yes, that is all we want. But still there are massive corruption scandals being reported at the county level. We still have a few black spots here and there. having such a sober conversation, transparent papers placed on the table saying that this is what we want, this is how much we have spent, is it really possible? If you look at our culture in the country and what we consume as information on how there's been a huge misappropriation of public funds, could this be what is even affecting, you know, some of these initiatives that we need to be having?
Can we have a new normal? We've had a new normal with COVID, haven't we? We've had
that
a new
normal.
We've had a new normal.
That new normal on corruption, that's a hot button. We have tried to have a new normal when it comes to matters corruption, but
let me tell you something. In matters development, the correlation between development and corruption is so clear. For countries that are corrupt, there's not going to be development. And that one is statistically proven over time. It is unknown, you know. So there's a need for a new normal. How do we make that new normal happen? We have public participation within the Constitution. I think what Kenyans we are very good at doing, we are very good at circumventing whatever is very clearly put up in the Constitution to help us in many ways for our own good. What did public participation want to do? Public participation wanted to create transparency and accountability. How will you be able to take money away when there's transparency and accountability? Open governance partnerships, OGP. That's how all the countries in the world are running. All the conferences in the world now are talking about our open governance system. Surfing right now, you should be able to go and click on the button, for example, in the health ministry and say, oh, COVID funds, have them in use. And that information should be able to come through clearly in detail over time. So this is something we've talked about since independence, since I think early 50s, early 60s, 1960, by the time we get independent, 1963, this has been a war that has gone on for too long. What I think has happened now, and it is a good thing, people are speaking louder and better and clearer.
It's coming out.
Yes, our ICT is making it possible. It's making it possible for you even anonymously to say, I'm not sure about that budget, can I hear about it? You know, people can be able to talk. The freedom of expression has also increased. Media have also played a role in enabling people to be able to express themselves. So I think we're getting there. We are building up to that. We need to get to a point where it is the new normal. I hope
we're getting to the new normal, because my prayer is not that corruption has become the new normal.
No, it should not be.
We have not normalized.
No.
When you put a young person at a point where they have no option but to bribe to get a job, when you put a young person at a point where they have to bribe to get grades that they've worked for, they've studied hard, and then they want to graduate, and you push them to the wall for them to part with something to get what they've earned, I hope corruption is not the new normal. You know, I hope the new normal is coming.
The new normal should be a zero corruption situation. Yeah. And I remember in the 11th Parliament, you know, this discussion started in the Senate, and we're saying, oh my goodness me, one of the things that has been devolved, unfortunately, is corruption to the counties. And we talked about it for a long time in the Senate, you know, saying, oh my goodness me, this is now devolved. What are we going to happen? You know, the issues that we've been facing at Senate in terms of oversight, even of the governors coming in and, you know, being told there's this amount and there's this amount that needs to be explained. Public participation was to sort that. Public participation barazas would be able to call governors and the county governments and say, here's your CIDP, your integrated development plan within the county. Tell us, this is the project, how far has it gone? Where is it? There's a stadium. Where is that stadium? We need to be, in fact, I want to say in Kiswahili, iko wapi? Where is that stadium? We want to say, but you see, that is, for me, the utmost power was given in that provision, in that article for public participation. What has happened is that it has been distorted to a large extent. You have public participation where even the people who should be coming to ask questions maybe haven't even been informed about.
But who is this public?
The public is the Mwananchi, but the public
now
can be dead.
Are they empowered to feel like they have that power to come and question such issues?
Yes.
Or do they still hide under the umbrella of, my leader has said this is the direction, so this is the direction we take? They still have those voices that speak for them. Who is the public? And do they know their power?
Yeah, that's important. I think there's a new voice from the public that is really coming out, and they're able to articulate issues, and they want to be there. there is a way that sometimes they're deferred by not getting space. So if, for example, I want to have public participation where I'll have only views which are conducive to what I want to hear, I will not invite that particular group. But these are not things that cannot be done. Communities can just say, if we have public participation, we must have so-and-so and so-and-so and so-and-so and so-and-so at that public participation. If that doesn't happen, we must have the religious representative, we must have our elder, and this elder must be able to speak the language we want them to speak. If they go and say something else, we're telling them, get out, you know. So again, it's how societies organize themselves. Unfortunately, I think in the case of Africa, looking across the board, we are still struggling with that. And we need to be able to get to a place, because it's really just to address, do we want to move forward in terms of development, then we must get rid of corruption. That young man who is struggling for a job and who has to pay, probably is the one who is going to come up with the great vaccine because they have ability. They will miss that opportunity. Somebody else who has to, can pay, who probably didn't work as hard, didn't get that A, will miss the opportunity. Who is the loser there? It's a society in the long run.
Yeah, true. We are losing a lot as we continue going in the wrong direction. I want us to now tailor this conversation to what we are now dealing with, the coronavirus pandemic. It's a total dynamic shift we are looking at in terms of our healthcare system with, you know, people like you pursuing different courses to make sure that we approach this in different dimensions and get a solution. But then I want us to look at right now, if you look at our healthcare system, vis-a-vis what we are dealing with, this deadly coronavirus. Yesterday, we recorded 25 positive cases of COVID-19. It came just a day after we recorded 30 cases of COVID-19. We have not witnessed this trend before. We are trying to flatten the curve. But what we are seeing is that the cases keep surging by the day. If this trend continues, I hope it doesn't. Looking at our healthcare system and how our hospitals are, how our healthcare workers, their working conditions, how they're remunerated, can we really manage this? Can we really deal with this pandemic effectively?
I think if we look at the magnitudes of Italy, if we look at the magnitudes of New York, the magnitudes in Germany, it created so much stress, even for them who have better health systems. We saw pictures of people who were actually making mini beds. Some of them were on the streets. We actually realized they couldn't also even deal with the ones who had died. Funeral services were completely overwhelmed. Any system would be overwhelmed. Kenyan system would be overwhelmed with such numbers. Efforts have been made. We've just seen Muranga coming up with the ICU. Efforts have been made in Mombasa. We've seen Mheshimiwa Governor Joho really taking the war on COVID-19 a step further and trying to prepare the county, trying to make sure that the hospital is running, that the beds are in place, that communities can be sensitized, and talking to communities, talking about them testing and everything that goes on with it. But I think so far, the only thing I can say is we just have to pray and do as much as we can possibly can to flatten that curve. The solution is in flattening the curve as quickly as possible. Initiatives, yes, are being made, and that is rightly so. A lot of mass testing is taking place. We're having the contact tracing that is taking place. We're having quarantining of people. But COVID is COVID. COVID is COVID. It is a pandemic. It is a virus that we really don't fully yet understand. Even China doesn't understand it fully. New York doesn't understand fully. Today you hear one thing.
Tomorrow you hear the virus that was in China is not the one that we are dealing with.
And maybe there's another one that has also even started off, you know, Hunter virus maybe has come in China. People, remember, had the debate about, is it airborne, isn't it airborne? You know, all these issues are coming up. But one way to look at it is, yes, the information that we have that is being put on the floor, how do we control it? How do we help ourselves, even with what we have? So that becomes very critical.
Looking at our healthcare system, we really should not allow this to explode beyond.
We cannot afford to allow it to explode.
What we can
and
control,
this is what I think
we will not manage.
I think, well, we don't want to be pessimistic, because you will have to manage with what you can manage. And we don't know, so we can't project. But we can look at cases like Italy. We can look at China. We can look at the UK, where we had the PM, Boris Johnson, actually being taken in, you know. So if we're thinking about, and then I think we can also then quickly look at our own parameters, which are very different from those in the developed world. We have an urban community and a very rural community. We have porous borders, for example, you know, and the issue of now truck drivers, for example, coming in from Uganda. We have a porous border on the Tanzanian side, both at on the side of moving to Tanzania after past Kitengela, and on this other side at the Lunga Lunga in Kwale County, where I come from, and all these issues. What I think is this. We have such dynamic issues, and I think I was just looking through it in terms of a case study. If you look at Rwanda, they've tackled it differently. You look at Uganda, they have tackled it differently. You look at Tanzania, they have tackled differently. Because the issue was, how do we handle this? Do we allow people to continue? Do we salvage the economy versus the life? Do we have them run all together? And I think all these present different case studies. I don't think in research you'll say, this was the right approach, this was the wrong approach.
Everyone is dealing with it in their own way.
So we'll say, this country followed this approach. These are the advantages. These were probably where we didn't really hit the mark. And so it's still something to be discovered. But I think what now we need to be saying to people is wherever you are, do everything that you can to keep healthy, for example. Watch over what you take. I mean, there are certain things that, for example, that people can do, and I've had people discussing, you know, you can do the hot water, for example, because we know it can clear up the system. You can do the fumigating and trying to do with the Vicks. You can try to make sure, and I think people are doing that, Kenyans. The moment you think you're beginning to have a flu, fight it out, you know, eat healthy, exercise, everything that you can do. And more importantly, when you think that you do have the virus, quickly isolate, either self-isolate, and people have been able to do that. And neighbors have been very keen, and I've had various incidences where I've been talking to different people, where neighbors have been very vigilant. And they've said, so-and-so arrived from I don't know which country, and I'm seeing them not self-quarantining. This is the right direction to go.
And neighbors have also been calling the police in case they suspect there is a party going on around. So we've seen quite a number of people being,
nabbed
arrested.
Is the word.
Nabbed after the police received a tip-off from neighbors. But then let's look at. This is teaching us a lot, right? At this time, we are really reflecting on so many things as a society. I want to look at the health sector because that is what we're focusing on this morning. What is it teaching us? What is it telling us about our healthcare system, basing on how we are responding to this? We've had even healthcare workers complaining of lack of personal protective equipment. There's still lack of enough capacity in terms of ICU. What is this telling us about our healthcare system? What do we need to do to change the narrative?
I think this is telling us, and I think what we need to pick up immediately, is how to really get the healthcare system to its optimum, including universal health coverage, who is covered, who is able to be covered, what do people resort to, can people get to hospitals, which hospitals are they getting to, the costs of the hospital sometimes are very exorbitant. You find somebody just staying at home because they're saying, okay, I can't go to hospital, I cannot afford. How are those who are able to deal within a system, NHIF, for example, how are they able to be contained with that specific system, and how are they able to work? Turning the angle on the other side, how are we starting from the base, for example? How are we tackling our community health workers? How are we grounding them? How are we grounding the clinics? It's one thing to have a clinic, but if you go to the clinic doesn't have medicine. The medicine that was meant to be in the clinic was taken elsewhere, or maybe it never got there, you know? So these are sort of things, because for me, I think it's always health first. And I think that logically makes a lot of sense. So if we don't take care of the health system, I think what this is teaching us is that it's very important to have a very functioning health system at whatever whatever cost. And even if it means us, for example, now that we are able to maybe even get, I don't know, maybe donor funding or something of the sort under COVID, really just say this is the way we want to do our things. For example, the issue that is coming up in various cases, the issue of PPEs, for example, protective gear that people should be putting on. Is it sufficient? Has it been given? Do the healthcare workers have that? Are they able to use it appropriately? What is really happening? So I think one thing that has happened, Safin, I think if we'd been hit fast, if it started from Africa, would have really had quite a lot of dynamics in terms of even beginning to cope with it. We were, I think, in a sense, lucky in the sense that we saw it hit other places first. It started off
first.
in China. So we saw what China did. We saw them spraying, for example. We saw them self-isolating. We saw them doing quarantine. And that quickly gave us a way forward. Not that I'm not saying let's borrow everything that's coming from outside, and that's not what we have done. We've tried to also look for our own indigenous ways of responding to it. But clearly health systems, in terms of capacity for people, in terms of the money that goes into it, we can't go clearly with this whole issue of strikes, and I think there's a looming one now as well.
Let me take you there.
Yes.
Let me take you there now that you've touched that button. Yesterday, representatives of 5 unions representing health workers issued a 14-day ultimatum to have outstanding issues addressed, failure to which they will go on strike by the 18th of May. And these issues include the health workers, they're decrying of poor working conditions, lack of promotions, and this is not new. We've had this before. Inadequate working equipment, especially now during the COVID-19 pandemic. They want risk allowances, they want harmonization of these allowances, and they also want issues of, the permanent and pensionable funds to be looked into, and a better package for healthcare workers to be provided at this particular time. Are we being fair? Have we been fair? And for these issues to be coming up now, we need them there. They are the front line. We've really hailed and celebrated them as the frontline soldiers in the fight against COVID-19. But have we been fair to them? Have we recognized that they indeed they're in the front line? I think the health workers is one category of workers in Kenya who have been very open and very vocal. They've been heard over time. If they were coming out now, only during COVID time, we'd say, how come they've been quiet? Now maybe they want to take advantage of a situation. And that is not the case. They've always, at the earliest opportunity, been able, they have a very good union that is very vocal. They keep bringing out the issues. It's one thing to down your tools and say, I'm down in my tools. But if you're down in your tools and you're indicating very clearly what the issues are, and the issues you've read are key issues that, in terms of just labor relations, should be in place. And they're saying, look, these are the issues we have to deal with. These are pertinent issues. They're pertinent issues in health, they're pertinent issues in education, they're pertinent issues in any sector, in agriculture. You'll find these issues coming. Clearly now more than ever before, it would be a big blow. This is not the time to have a strike in That is exactly my question. Why now? We really need them. And I understand where they're coming from, but have we been fair to them? Have we let them down? Have we not done enough to really...
I think they've spoken before, and they've spoken very loudly. I think what needs to happen, I think the health ministry needs to engage immediately. I think they just need to engage, be able to sit around the table, identify what the issues are and to what extent can they be solved. They might not be solved 100%. And in anybody who is coming, when you're having a dispute, you seed some things. You say, okay, for now, we can take it up to here. These are the most critical. This is what we can, this is our basic minimum, so to speak. So that they can actually come and articulate this and let there be some sort of improvement. I think for us, and this is the difference between a country whose GDP is lower than, for example, other more developed countries. In other more developing countries, they have the kitty, they have the funds. They can actually distribute the funds and say, we do 1, 2, 3, 4. But I think for us, it becomes a jangling, a sort of a balancing act. Doesn't help us with corruption, because we're saying, okay, some of this money has probably gone into corruption.
Why not give them to
Exactly. But for us, we already have a GNP that is lower. When we look at the appropriation and we look at the division of revenue for the different sectors, we find that health, education probably doesn't have as much as it needs to have, which is part of what needs to solve this problem. I always say the way forward for dispute is engagement. Right now, anything would be hypothetical. There has to be a very open forum where the health minister can actually sit with the health workers and sort these things out once and for all. This is not new. This is what is happening in the health sector. You will know that even in the teaching sector, the University of Nairobi and other universities for a long time have had this collective bargaining agreement, CBA dispute, where an increase is meant to be done at a certain time. Of course, we'll say we don't have the money, we don't have our GDP. If we didn't have money pilfering elsewhere, we'd probably go with that story. We'd say, yes, we understand. But I think it doesn't help the fact that people feel maybe now they're coming out and thinking, well, there have been funds that were given and we're not even really sure about the process of accounting for each and every particular article that is there or item that is there. They're feeling this is a good time, but their concerns are real. Their concerns are real. And so might the concerns also for the government be real in terms of the money. They just have to find a way to circumvent, get that money, and be able to have a discussion. They might not be able to sort all the issues for the health workers at the moment, but I think some of these that they're raising are critical, really need to be addressed.
It really needs to be addressed, especially now.
Yes.
Especially now.
Yes.
But, you know, we would say that issues to do with probably promotions or pay, issues that involve money may take a process to reach to a conclusion. But it breaks my heart when they complain about availability of personal protective equipment. This is something that needed to have been done yesterday. They're actually dealing with so many patients on a daily basis. Some could be coronavirus positive, some are negative. This person could be handling like so many people in a day. If they contract the virus, you can imagine the level of distraction that this can cause in terms of the spread of coronavirus. Protecting them is not just for them as individuals, but even for us as a country.
And even for
I think they should be given the tools of trade.
Even for their families when they go back to I mean, one person who tests corona positive because of work and they go home, they're transmitting that again back to the family and to the people. So these are valid concerns, and the issue of PPE should have been at the utmost hierarchy of addressing, right from the word go, so that this is all sorted out. And as I said, we sort of saw this coming, didn't we? We saw other countries sort of all exposed suddenly, and we're like, okay, we don't know whether Africa, what will happen in our case. Well, the virus doesn't like heat, it doesn't thrive in heat. So we're thinking, okay, maybe in Africa we will have God helping us in that, you know.
But it's here with us.
Yeah, it is here with us. It is here with us. But yes, to a large extent, also the weather might also be aiding to ensure that the cases are not completely full-blown, maybe not, you know. But I think some of the cases, what they're raising is not frivolous. I think it is real. I think they have the data. And they can actually, once they're on the table, they can say, look, this is what we've received so far as PPEs. Right. This is what we're receiving as this and the other. This is not adequate, you know. So there's some sort of delinking that needs to be quickly addressed to ensure that these issues are sorted out. They're not frivolous. They're very, very important and serious as well. Well
said. Mheshimiwa, right now, other counties took it upon themselves to take care of their own healthcare workers. Machakos County, I cite, is one of the counties. The governor, Dr. Alfred Butua, moved to provide a special allowance, a special package for the healthcare workers in his county. He was saying these are actually people who are risking their lives to do what they can to save the lives of people. And it didn't go well with the SRC. There was that back and forth about whether it was legal, whether it would, he could have done that in the manner in which he did, that it was going to bring sort of, you know, disparity among the counties in terms of, you know, pay and allowances. One of the issues your bill seeks to address touch on disparity in the counties when it comes to the healthcare system. I want to talk about, comment first on this, you know, specific case about every county taking their own initiative to deal with their own issue the way they know. And tell me how then do we reach a point where there could be equality among all the counties when it comes to addressing issues, healthcare? Can we ever get to that point? How do we get there?
I think we need to be able to get there. I think it is possible to get there. And this is what this bill is addressing, that there shouldn't be disparities between the counties, that each county should have its equal share of medical facilities, that it should have its equal care, an equal share for community health workers and for the work that they're doing.
What is the damage that could be there in case we allow that inequality to continue among counties? What is the worst case scenario?
It comes back again in terms of output. Worst case scenario, you're going to have more live deaths, we're going to have more mortality, we're going to have bigger disparities even in terms of early childhood, for example, both mortality and functionalities. You're going to have people who are not able to work, you're going to have people who are dying faster, you're going to have people maybe who are infecting each other, you're going to have an unhealthy community. So you're going to have one community in one county that is thriving and another not out of their own fault. And this is, I think, the basic principle of the equitable revenue distribution and division within the division of revenue bill. if we wanted to be an unequal society, we'd say, okay, we're going to look, and this is why when you look at the formula for the sharing, for the equitable share, there's a lot of fighting going in to and fro, because we're looking at population, we're looking
boundaries.
at boundaries, you're looking at poverty, you're looking at fiduciary nature. So what I think happens, because I remember when I was constructing the Natural Resources Benefit Sharing Bill, one of the arguments that was coming was like this was an on-source revenue sort of creation bill, and they were saying whatever extra that communities and counties can be able to give in, let them put it in and then let it be shared equally. And people were saying no. When we visited communities, we are rich in natural resources. They said no. Well, if we have our resource, let us, gain from that resource. Why isn't another county able to do that? I think we are a nation finally. We have the various counties, but we are a nation finally.
We are one at the end of the day. So how practically, before we go on a short break, how is your bill, practically solving this disparity among counties?
It's solving this disparity among counties, but ensuring that the equal distribution and the equal taking care of the community is done across the board for all the various counties. And that's why it's saying, instead of certain counties that have already gone ahead, moving on to make their counties okay and better, that is okay. It is an intervention. When it comes to this particular bill, we're saying these are the standards that should be followed. These are the structures, these are the functionalities, this is the way it should be across every county. Let every county be able to do that, so that even the most, maybe county which has not begun to address this issue can actually be able to address it through this particular system. So that becomes very critical. In a situation like we've spoken about in Machakos County, an initiative has been made, but we know SRC always comes up with this sort of a notion of, is this money actually money that should be going to the counties? Are you going beyond the kitty? Because this is a commission and it's the one that controls how money should be going to the various payments, and therefore that's where the issue comes in. So I think if you had the provisions of this bill in place, then you would not have even the issues we're discussing now in terms of trying to make a county better, one county better than another. It should be everything, at least there's a standard premium, and then people can just make it better from there.
All right. We're coming back to continue having this very important conversation. Kenyans are decrying. It's tough times, especially on the pocket. People have lost their jobs. There's a lot happening. And this is actually something that we really need to take very seriously. President Uhuru Kenyatta really, brought sort of a sigh of relief when he signed into law the Tax Laws Amendment Bill of 2020. We'll be talking about how to cushion Kenyans economically during these trying times in a bit. But we are taking a very short break right here on News Check. Thank you so much for creating time for us. We still have more for you on the other side of the break, but continue talking with us on social media at KBC Channel 1, at Safin_Aching on Facebook, Safin Aching. Thank you for those who are streaming online. We really appreciate you creating time for us. We take that break now. Welcome back, and thank you so much for continuing to stay with us as we continue with this program, News Check, in case you're just joining us. Today we are talking about the healthcare system and just looking at how we can make a bit of improvements, especially now that we are dealing with the COVID-19 global pandemic. There's a lot that has been said, a lot of efforts have been put in place, but we're still facing a lot of challenges based on quite a number of issues that probably we did not address when it comes to our healthcare system before. But we can go in the right direction, and indeed we are trying to do that, and that is what we are talking about, the COVID-19 global pandemic, looking at the healthcare system. And also right now we want to take this conversation a notch higher to come closer to your heart as a Kenyan who is watching us this morning. There is a lot that has happened courtesy of the coronavirus pandemic that has caused now the economic downturn. There are so many people who do not know their fate when it comes to their jobs. There are others who actually have had salary cuts. There are a lot of adjustments have had to be made economically at this particular time. Let me take you back to something that happened just a while back. This was when President Uhuru Kenyatta signed into law the Tax Law Amendment Bill 2020 as part of measures to cushion the public against effects of the COVID-19 pandemic. The bill was published on March 30th, and it amends tax-related laws, including the Income Tax Act, Cap 470, Value Added Tax Act of 2013, Excise Duty Act of 2015, Tax Procedures Act of 2015, among others that are related to just helping Kenyans in this particular time. And it also touched on the issue to do with how much we're earning, the pay as you earn. There was a relief. The law, which mainly targets low-income earners, includes that 100% pay as you earn tax relief was given to employees who are earning less than 28,000 per month, and then there were others who were earning above that that are so far now going to be benefiting from a pay tax reduction of between 30 and 25%. What did you think about this move? I know for everyone is finally,
I think it was important. I think it was an important move. I think it came in the spirit of recognizing the economic hard times that Kenyans are going to face as a result of COVID. It means many people were not going to be able to work. Indeed, many people have actually lost their jobs. Some have actually had pay cuts at their organizations, 25% off, 50% off, some even more than that. So clearly the issue of finance is very critical, because this pandemic actually has taken us to the level where we cannot do things the normal way. We cannot work. We cannot be able to do what we usually be able to do. So I think it was a well thought out one, and the fact that National Assembly was actually quickly able to put the necessary amendments to do this, I think this has been well received and very critical as well.
Is it going to have any long-term effect on us? The people who actually looking at, this in the coming days, economically speaking, is it going to affect us? Because the tax is actually one of the sources of revenue for us.
Yes.
So is it going to affect us in any way? How do we recover from that?
I think it will. I think it will. I think it's going to give us. It's going to be a very difficult balancing act, because we know that the revenue is collected. A lot of revenue is collected through KRA and through the tax system, and this is the same money that's meant to be put back into the kitty and then distributed as equitable share revenue, even through national government, to actually be able to help out. It's the same money that's meant to go into hospitals, into education, into the various key sectors of the country. So I think very quickly we need to quickly be able to think about other mitigating measures. For example, if I was to make suggestions, I would make suggestions across, for example, especially if we had more mechanized agriculture. Certain things can still go on, because when we're speaking, we're thinking and saying very soon we might have another situation which is really addressing the food security of this country. Are we going to be able enough food? So I was thinking that in between this session, we could have, for example, bigger or greater energy being put, for example, in the sectors that we can, where people can work safely, for example, in the farms. Planting can continue to go on, so that at least that also mitigates. I was happy that the other day I saw that, for example, fresh flower export industry has begun to open up. All this is meant to be for the short term, but we don't know for how long it's going to go. So I think this is a measure that will help, because it will at least ease a little bit of money, even as a tax reduction to the people. But I think in the long term, other sectors that can quickly come in will help us, give us the buffer. That will help us give us the buffer zone that will be critical in ensuring that our GDP is not completely affected.
Okay. Yeah. That is just a short-term solution for what is happening. But then we may, need something that will be a lasting solution. I also want us to look at the employer-employee relationship. We've seen quite a number of people who have been laid off from their jobs. Employers is resorting to such measures just for them to survive. Do you think there could have been a better way? I've had, the government, even President Uhuru Kenyatta himself, making a call to employers to, at this particular time, really try not to make people lose their jobs. But if you look at even the point in which they themselves are operating, these are unique circumstances for everyone. Are there other, probably ways that we can explore to make it work for both employer and employee?
One of the ways that can be explored, and I think would have done more maybe over time, is the ICT sector. And that's where everybody is sort of leaning back to. For example, if you look at countries like the UK, some of the countries in America, I don't know about China to what extent, but the ones I've just quoted, to a large extent, were able to do stay-at-home, work from home sort of policies. And even in Kenya, and it's interesting for many industries, they're coming up and saying, oh, you know, we've been able to work at home. Indeed, for some of the sectors, we've had sort of like a break in terms of a bit of humor, where people, for example, are working from home and then their background is being seen and, you know, like, be careful. So all these new etiquettes coming in. But we've realized that a lot of work can actually be done from not necessarily from the office of...
And we were sharing with you how this actually speaks volumes as to what we can achieve going forward. But the governor says it's going to go a long way in providing essential services, critical services, especially now that the coronavirus pandemic is here with us. I know not so many counties are privileged to go this direction. And we've also had talks of inadequate ICU facilities in our country at this particular time. What do you think would be probably a survival mechanism for such counties at this particular time?
I think this clearly shows an incentive. You know, it gives an incentive even for the other counties. And I think because the counties under COG are able to talk with each other, I think a lot of best practices across the counties also need to be shared. You know, other counties can, for example, borrow from this initiative and make sure they're able to have a facility for themselves. Find ways of how have you been able to do it, and also how can we be able also to do it within our own counties and basically replicate that particular model.
There are others that have been innovative to use places like stadiums and proposing that they should be used as quarantine facilities and all that, just exploring all the necessary measures. Schools, for instance, have also some are being used, and also proposals are elsewhere to use them as quarantine facilities. So we may not have the necessary resources and money-wise speaking to construct new buildings and buy new equipment, but we can improve on what we already have. Exactly. For us to survive these tough times as we progress. Earlier we were talking about cushioning Kenyans against these tough times. And you know, this has really brought in some deep reflection even on my end as a journalist. I was sharing with you this earlier. I've been spending time covering stories about those who live in informal settlements and how they are coping in these trying times. And in as much as we may want to do stories about obeying government directives, social distancing, sanitizing, when you go to those places, the reality that meets you is really breaking your heart as an individual. For them, it's even on a normal day when there was no corona, when there was, things were just working, I would say normally. For them, they were struggling to get the next meal. For them, they were struggling to have enough space to survive in. They live in one-roomed houses or two-roomed houses. For them, it's a struggle every day. And now Corona has added the weight onto their shoulders. I don't know what we can do to assist such families, because for them, it's twice as harder as it is for other Kenyans. I
think it's a difficult situation, and looking through the measures, for example, the tax incentives that have been put into place, and some of the measures that, for example, working at home, for example, some of these measures have worked only for the formal sector. They haven't really worked for the informal sector. And I think this is where we really need to come up with ingenious ways of really trying to find and make a way that they have been reached. There are countries that have data about their people. They know who is where. They know who is earning, who is not in the, who is in the informal sector, and how much they're getting. At the Senate, we have the Pandemic Response and Management Bill 2020 that is also in its second reading. And it has come up with some critical socio-economic protective measures, safety net, that touch not just only on the formal sector but also in the informal sector. You know, in the formal sector, for example, at part 6 of this bill, they talk about the issue of tax incentives, which we have also mentioned. Moratorium on penalties, trying to ensure that penalties can be held for some time, contractual obligations, changing these, tenancy agreements, labor relations. But at the social safety net, for example, issues like cash transfers become very critical. And I think if you look at the statistics, if you can, for example, identify 1 million people in the informal sector, Unfortunately, again, these are the people whose voice is not really heard most of the time. I mean, when it comes to labor relations and contracts, they're there. They don't have a contract in everybody. The Mama Fua is going to wake up, Mama Nguo is going to wake up in the morning, go and wait for a job. If you drive across some of the centers, you're finding more and more of them sitting around a center, sitting somewhere, hoping to get a job. And maybe the jobs are not coming in as quickly as they ought to anymore. So this creates a situation. I think for such, cash transfers would come in very handy. Mapping them wouldn't have been so difficult with the data that we have, even maybe from Huduma number collection of information that we have, so that, for example, even in a month, I cannot say what figure, but I'm thinking even on a bare minimum, because maybe they will also have other sources of making money. If we said, for example, transfer 2,000 to 3,000 to these people, one, it would create equality, because then you have your M-Pesa number, maybe across the households, we could be able to map those houses, and they get their money. With that money, because shops are open, I can decide, let me go and buy my unga, let me go and buy my flour, let me go and buy 1 or 2, 3 things. Because again, even in the education sector, some of the measures that we have taken, including, for example, e-learning at home, the most vulnerable do not have the capacities for this. And when it comes to that, exams will still be held. How are these going to manage? The person deep in Kinango, deep in Turkana, that young boy, how is he going to be able? So I think we needed, apart from these measures, socioeconomic protective measures, really targeting the formal, some very specific one in targeting the informal. Yes. I've seen some of these in terms of, taking food and foodstuffs, and that is fine and that is well. It does happen in certain places. But I think cash transfers would have been quick, easy to disburse with the data, connectivity. We have data. So, for example, in a household, if I'm living there with my eldest child and, for example, a partner, a husband, a wife, etc., you can still be able to know this is a particular household. And then maybe some decisions would have been made by social scientists about who is the right person to send that money to, for example. All these sort of logistics sort of sorted out so that these homes could actually be able to find a way to be able to get a job. That's the one that comes to mind as something very quick and easy to do, because then in that you don't have to really struggle. The issues of utilities, for example, electricity, water. How is that going to be dealt with? What sort of measures can we put into place to enable, for example, that no disconnections take place during this time, especially of something like water? Information technology, I've mentioned it, rate and licenses, how will those still be enhanced? So I think most of the responses at the formal level have been innovative, and they can be able to touch. But I think at the informal level, this bill goes into details. This is the Pandemic Response and Management Bill 2020. That is an ad hoc committee from the Senate, chaired by Senator Sakaja, Senator of Nairobi. And some of these, this is now still under consideration, moving into an act. But if some of these are put into place, not only do they deal with COVID-19 now, they deal with management of a pandemic at any other time. And I think this is quite progressive for the Senate of Kenya, because instead of just talking about the COVID-19 now, we're making provision to put into place a raft of regularities and bills that can help to do this. We have the Disaster and Management Bill that is at the National Assembly. This was not processed. This is another bill that would have been able to put into place a framework to be able to deal with these issues. But from what you're saying, it's very, very, I think, disheartening, and it's something for us to be concerned about. We need to think about that, Mama Mboga. The good thing now, and I think on the side of the government, they did not go into a total lockdown. Because again, if they'd gone into a total lockdown, maybe it would have meant that such a person...
Would we have sustained that? We
probably, I think it would have been difficult. I think we needed to do it in with some sort of partial regularity about it. But again, also, I mean, we really need to think about it, because now we have various positions about whether to have a lockdown, whether not to have a lockdown.
There's still people calling for it, others are not.
Exactly. What about in cases where social distancing is not taking place and everybody is really congregating? What do you do in such instances? But again, at the end of the day, really the issue of livelihood, that this person needs to, this is not a person who is employed. So they don't have a pay cut to take. This is somebody who wakes up in the morning, they have to sell those carrots for them to get the money for that day. If they're not able to get that money for that day, how are they going to be reached? If, for example, there's a program to give food, to distribute food, supposing it doesn't get to them, for example, what do they do? So a little bit of food distribution, I think the issue of cash transfers, because if we quickly calculate 1 million people, for example, in Nairobi in the informal setting, times 3,000 maybe for a month, that's about 3 billion shillings going into a specific program where the outputs of that program would be more or less quite visible. That would have helped to some extent. And we saw these cash transfers. I can't remember specifically which country, but there are some countries, I think was it Ghana or Gambia, that did mass cash transfers. Rwanda moved also into cash transfers and also into drones that were going and distributing kitties with information, what to do, gloves, you know, making sure that people have even this basic like gloves and basics like masks, for example. There are some people still who don't, and you've covered these stories in the media saying that the people who still don't have them and can't have them. Yeah. And yet it's the minimum protection that we need in COVID times.
Yeah, that's very true. Let's also look at you know, how we have all responded to this. There was that committee that is chaired by the Health CS Mutahi Kagwe on you know, just generally looking at how we are addressing, how we are responding to this. We've talked about how Kenyans are responding, but how do you know, describe how the government has really, even in terms of communicating the daily updates, how do you know, describe how they have responded to the COVID-19 pandemic?
I think
since we reported the first.
Yes, yeah. I think under the circumstances, they've put their best foot forward. You know, in terms of, for example, reporting. That's very, very important. Giving the information about what the pandemic is all about. That information is out there. The adverts have gone out there. Giving information about the tracing, contact tracing that is going on. Giving the information about the numbers that are rising. Giving the information about being able to flatten the curve. That is all very fine, and that has come out very clearly. Other initiatives as well that would have been put in place, like the ones we are discussing now, maybe more information about where the gaps are would have been very, very critical. More information about, for example, how do we deal with masks, for example, and how do we mass produce? How do we, for example, get drones, if necessary, to distribute these masks to the different facets and different people? How do we ensure, for example, that people who go into quarantine, this is another issue that's coming up. There's a family in Mombasa that has been slapped with a bill of about 450,000 or thereabout, and they've said, look, this is the quarantine facility. In fact, the person saying, I could have spent this money in a hotel somewhere
where I'm more comfortable.
Exactly. So, but I think the fact that we were able to quickly have people coming into the country, being quarantined, for those who are coming in 14 days, of course, people will always have a counter reaction. But yes, that if you've been away, you have to be quarantined for 14 days. We have to make sure about your status. I think more information needs to still come through about the testing of kits, especially the testing kits, especially now with the information that's coming from Tanzania recently, questioning their efficacy. It's important for us to be able to do that, lay any fears to rest, say this is our testing kit, this is how it has worked, confirm.
But then how then do we deal with you know, cases that would sort of paint a picture as if we do not really, some people are not keen on working with the government? We were asking for testing, and testing was a very critical issue in the fight against COVID-19. We were saying, let's begin mass testing so that we get the real picture of how the situation is like. Now, mass testing has commenced in parts of the coastal region, but even since that day when that mass testing was launched, you still find the turnout being unfortunately and discouragingly low. People are not keen to take advantage of this opportunity. What does it tell us? Are we really ready to flatten the curve?
I think apart from that information that you know, free mass testing was going to happen, I think more information is coming. And I think as social scientists, we always look at reaction and counter-reaction and new facts that are coming up. And one of the issues now that needs to be addressed very quickly, I think, is the issue of quarantine. Because then what is coming from the ground now, from the reports that we are hearing people speak about, is that people feel, if I am going to be tested, what happens if I test positive? What will happen? I'm going to be taken into quarantine. I'll have a bill to pay. So, for example, if tomorrow health ministry comes up and says, you know, for certain quarantine where you've gone for a test and you have to be put somewhere, then it is free, for example. You see, that will address something which is probably creating another reaction.
There could be fear.
Exactly.
among
Exactly.
Kenyans
And this is
about
what,
the
yes,
consequences in case I'm positive. What next for me?
Exactly.
So Kenyans are shying away from it.
And the need even to address the issue of stigma that is also coming up, and people have been told, you know, the fact that you've been tested positive. In fact, I keep thinking and saying that you can test positive this by morning, and by evening you could be negative, and you could be negative by morning, and by evening you're positive, because the infection is not like as though it's not like when you're eating a particular thing, for example. So you could be fine right now, but unfortunately you might just touch a handle, maybe that was infected, and then accidentally touch your ears, eyes, and then you get infected immediately. So that sort of education, that even after you've tested, go beyond that and still take care of yourself. As you take care of yourself, you're also taking care of your neighbor.
All right. Senator Agnes Zani, thank you so much for your time. The senator with the highest number of bills now pushing this bill again, the Community Health Services Bill 2020. And we really hope to see, you know, the very best come out of this so that we can improve our healthcare system going forward. As a leader, I want you to talk to a Kenyan who's watching you this morning. What is that parting shot, that one word you want them to remember this particular morning as we deal with the coronavirus global pandemic? That
we are Kenyans, that we are a nation, that we stick together, we stay together in good times and in bad times, that we look for each other, we are each other's keepers. And now during COVID time, more than ever before, we need to have this mantra at the forefront of everything that we do.
All right. I keep saying this pandemic is like a shaky bridge. We really do not know. We are learning as we go, but any slight mistake can really have very serious repercussions. So stay on course and make sure you do what you can to make sure that you stay on that bridge. We want to be meeting you on the other side when all this is over.